Welcome to the deep dive. Today, we're going to be tackling something I think we've all experienced at one point or another in our lives: abdominal pain. You know that not so fun feeling that sends us searching for the nearest heating pad or reaching for the antacids? You shared some interesting research with us actually on how doctors in the ER diagnose and manage abdominal pain, and I have to say it's way more complex than I initially thought.
It really is. The abdomen is like a crossroads for so many vital organs, and pain there can really signal anything from, a minor indigestion issue to something much more serious. It's a real puzzle for doctors to sort out sometimes.
You're telling me the research you sent even provided a table listing a whole bunch of causes of abdominal pain.
Yeah.
I was shocked by how many different things can go wrong in there.
It's a pretty extensive list, right? And the table highlights how different organ systems, not just the ones we normally associate with digestion, can manifest as pain in the abdomen. So, of course, you have your usual GI suspects like appendicitis or a bowel obstruction, but then there are some more surprising culprits too.
Like what? Give me the unexpected stuff.
Well, think about an ectopic pregnancy. That's where a fertilized egg implants outside the uterus. That can actually cause abdominal pain, not just the typical pregnancy symptoms you might expect.
Wow, I had no idea. So it's not always just about what you ate.
Not at all. Even something like a kidney infection, what doctors call pyelonephritis, that can radiate pain to your abdomen. And believe it or not, even a heart attack, or what we call an MI, can sometimes present with abdominal pain. It's mind-boggling how interconnected everything is in there.
So you're telling me that just by knowing where the pain is, you can start to guess what might be wrong. Like if it's in the lower right part, could it be appendicitis?
You're catching on. Doctors use the location of the pain as a starting point, like a first clue in their medical detective work. They divide the abdomen into these different regions, right? Right upper quadrant, left upper quadrant, and so on. It helps them narrow things down, kind of like, abdominal real estate.
Okay, that makes sense. But pain is pain.
Yeah.
Right. What else do doctors need to know besides just the general area?
That's where a thorough history and physical exam come in. Those are essential, especially when dealing with something as multifaceted as abdominal pain.
What kind of questions would you ask someone coming in with abdominal pain? Besides the obvious, where does it hurt?
Well, we need to understand the pain itself. Doctors use what we call the OPQRST pain assessment. It's a fancy acronym, but basically they'll ask about the onset of the pain. When did it start? Then they'll ask about the quality, what does it feel like? How bad it is on a scale of 1 to 10. They'll want to know if it's constant or if it comes and goes and what makes it worse or better. That gives us a much clearer picture of what we're dealing with.
So it's like a pain personality profile.
Exactly. And of course, we'll delve into your medical history. Have you had any surgeries? What medications are you taking? Any pre-existing conditions? All these things can be relevant.
I imagine they'd also ask about, bathroom stuff, right?
Absolutely. Bowel movements, urination, all those details can offer valuable clues. And what's really interesting is that seemingly unrelated symptoms can actually be important too. For instance, we might ask if you're having trouble breathing or experiencing chest pain. These might seem unconnected to your stomach, but they can help us connect the dots.
So it's really a holistic approach, considering the whole body, not just the tummy?
Precisely. And then there's the physical exam itself. We'll check your vital signs, listen to your heart and lungs, and gently feel your abdomen for any tenderness, rigidity, or anything unusual.
Hold on, the research mentioned a digital rectal exam, or what's also called a DRE. That seems pretty invasive for what could just be a simple stomach ache. When is that really necessary?
You're right. It's not a routine part of every abdominal pain evaluation. It's reserved for specific situations where we suspect there might be a problem in the lower digestive tract or pelvic area. It helps us gather additional information that we might not get from just the external exam alone.
Okay, that makes sense. So we've got location, the history, the physical exam. But sometimes doctors need a little more help to crack the case, right? That's where those fancy medical tests come in.
You got it. That's where we turn to our diagnostic tools. Think blood tests, urine tests, x-rays, ultrasounds, CT scans. Each of those provides unique information that can help us hone in on the source of the problem.
Okay, so break those down for me. An x-ray, an ultrasound, a CT scan. What's the difference? And when would you use one over the other?
Well, x-ray is like taking a snapshot of your insides. It's good for visualizing bones and can be helpful if we suspect a bowel obstruction or a foreign object, let's say, in your digestive tract. An ultrasound uses sound waves to create a picture and is especially useful for seeing organs like the gallbladder or the kidneys. And it can help detect things like appendicitis, especially in younger folks.
And a CT scan.
Yeah.
That sounds pretty high-tech.
It is. Think of it like a 3D x-ray. It gives us much more detailed images of your abdomen and pelvis. We often use CT scans to evaluate things like appendicitis, diverticulitis, and aneurysms.
So basically, you choose the right tool depending on what you're trying to see.
Exactly. It's all about matching the tool to the suspected problem, and sometimes a combination of tests is needed to get the full picture.
This is all making sense. Now, we've talked about a lot of different possibilities, but I think it's important to touch on the more serious causes of abdominal pain, the ones that really warrant immediate attention. The research listed some pretty scary-sounding conditions under emergent causes. What are some of those red flags we should be aware of?
You're absolutely right. There are certain situations where time is really of the essence. We need to act quickly if we suspect something like a perforated viscus, which basically means there's a hole in the stomach or intestines, or a ruptured abdominal aortic aneurysm, or what we call a AAA. Those conditions can be life-threatening and often require immediate surgery.
Okay, hold on. You mentioned a ruptured AAA. I've heard of an aneurysm, but what exactly is that, and what are the signs that something that serious might be going on?
So imagine your aorta, the main artery that carries blood from your heart to the rest of your body like a garden hose. An aneurysm is a weakened section of that hose that bulges outward, kind of like a balloon. If that weakened section bursts, that's a ruptured AAA. And it's a very serious situation because it can cause massive internal bleeding. It's like a burst pipe in your body.
Yikes, that sounds terrifying. So what should we be on the lookout for? What are the warning signs?
Well, the classic symptoms are sudden severe pain in your abdomen or back, often described as a tearing or ripping sensation. You might also feel a pulsating sensation in your abdomen, almost like a heartbeat, but in the wrong place. And because of the internal bleeding, people with a ruptured AAA often experience a drop in blood pressure and can go into shock. It's a true medical emergency.
So if you experience those symptoms, it's a straight to the ER, call 911 kind of situation. No messing around.
Absolutely. Every second counts in that situation. It's always better to err on the side of caution when it comes to something as serious as a ruptured AAA.
Okay, good to know. Now, the research also talked about what happens after the initial evaluation in the ER. It seems like even if you're discharged, it doesn't necessarily mean you're completely in the clear, right? What are some things people should keep in mind when they go home after an ER visit for abdominal pain?
You're right. Going home from the ER doesn't always mean everything is perfectly fine. It's so crucial to follow your doctor's instructions carefully and to really pay attention to how you're feeling. Even if you've had tests and everything seemed okay initially, things can change, so knowing when to return to the hospital if your symptoms worsen is essential.
So it's all about staying vigilant and listening to your body.
Exactly. Don't dismiss any new or worsening symptoms, and don't hesitate to seek medical attention again if something just feels off. Your health is worth advocating for.